If you're over 40 and dealing with knee pain, you've probably been told to stop running. But one of my clients in her 50s was told the same thing, and she was headed toward knee surgery. Today, she's running pain free. And here's exactly how we did it. I'm Dr. Ray Peralta, a physical therapist and run coach. In the past 10 years, I've noticed many runners get hurt year after year, training for marathons, and it's usually due to some common training mistakes. And if you want a copy of this Google Doc and to learn more about running pain free, I'm sharing it in my free online run group. Click the link in the description to join. So, why most runners over 40 keep getting hurt and plateau? See, the constant cycle of injuries. And I see this. There's even the stats vary, the exact numbers vary here. They could be as high as like 9 out of 10 runners have to sit out of training every year. Some people say 80%, 70%, whatever. But a high percentage of runners end up getting hurt. And common overuse injuries, right? Knee pain, shin splints, Achilles tendon pain, right? Whatever injury in the month. And, many runners have this belief that, oh, I just can push through the pain, ignore the pain, that it's normal, that, oh, having pain during running is normal. No, it doesn't have to be normal. You could actually enjoy running and be pain free, even if you're an older runner. Or the belief that you just have to run more. Oh, if I just keep running more, I'll get better results. The thing is, keep running more and more without a solid recovery plan leads to breakdown. And this is the same mistake I see with many runners who are training like for marathons, especially the more beginner or even intermediate runners who, again, who think they're doing everything right, but then they end up breaking down. Or maybe they've been told to stop running altogether or just to take it easy. Like, oh, I'm just not going to run more than a 5K, right? So they just kind of stay within their comfort zone, never push themselves. And that's also not the solution either, just to take it easy and avoid any type of exertion that's beyond your comfort zone. One of the biggest things is actually not doing proper strength training, mobility, and the recovery habits, right? Or you think that, oh, just because you're getting older or you have arthritis, you have to slow down or quit altogether. And we're going to talk about, how you can actually work around those things and enjoy running well into your older ages, right? Even if you're 60s and beyond. So the athletic runner method is something that I developed. It's a smarter way to train, right? It's not just from just running or just following some other running cookie cutter plan. The way I work with runners is a full body system, right? Because running alone isn't enough. Your body also needs strength training, mobility training, proper recovery habits. See, performance improves when you treat your body like an athlete. You don't have to be an Olympic athlete to benefit from training like an athlete, right? You could be an everyday person working a full-time job, having other life responsibilities, and you don't also have to spend hours at the gym or on the road. Running doesn't have to consume your entire life either. That's why I'm a big fan of a 3 runs per week framework, right? You could still run less, but with more purpose, right? More quality. It's quality over quantity, right? Doing quality run workouts. And it also frees up your time. So now you could do proper strength training, mobility training, the recovery, which is key for longevity, right? You don't need to run 6 or 7 days of the week to improve. Heck, you can even train for a marathon on just 3 runs per week when you're doing the other additional training that I recommend, which is the strength and mobility training and even cross training as well. And doing this way, runners are able to enjoy running and oftentimes also address these nagging injuries that they're dealing with. But again, you just can't do it haphazardly, right? So you have to do the appropriate strength that's appropriate for runners, right? If you start training like a bodybuilder, you may end up getting different types of injuries that bodybuilders tend to get, right? So it's about strength training that's smart for durability, not just to bulk up, to have bulky muscles, whatever. And I have nothing wrong with muscle hypertrophy, but sometimes people take it to extreme. Or the other swing of the pendulum is where you avoid lifting altogether because you're afraid that if you lift, or maybe you only lift very light weights, like, oh, I'm just going to do high repetitions, light weights, because I just want to train for endurance. That's a mistake as well. There is a happy medium where you train heavy, you do some high repetition effort as well, but you also do explosive training, right? Things like jump squats, speed deadlifts, things like that. But all these types of modalities can be integrated in a smart way. Something that I teach as part of this athletic runner method to actually help runners get stronger, less load on the joints, only 2 to 3 times a week. And it doesn't even have to be time consuming either. The way my strength methodology, you don't have to be in the gym for hours. Heck, a lot of my strength workouts are only 30 minutes, 20, 30 minutes. And you could do this smart type of strength training. It's going to improve your running economy, can even improve your VO2 max. So strength training isn't optional for runners, right? So many people, oh, I could just skip strength training altogether, or just do just high, again, the high repetition, low weight method of strength training. No, that's a big mistake. And it shouldn't be optional. If you want to be injury resilient, enjoy running for longevity, you got to do strength training, but the proper strength training as well, right? And if you don't know what you're doing, obviously working with an expert, someone to help you understand strength training for runners can make a big difference. And, being durable so your body doesn't break down, more injury resistant. The other thing that matters is mobility training. So many older runners have stiff or achy joints. So I recommend at least 10 minutes a day of daily mobility to keep your joints moving well. Now, you may have different tight or stiff areas, so this is not a one-size-fits-all approach. But when you do the proper mobility work, your joints feel mobile, you're able to enjoy running. And yes, there are some folks who are extremely tight who might need closer to 20 minutes a day. It does happen. But if you're pressed for time, at the very least 10 minutes per day, but it's on an everyday basis, like brushing your teeth. You don't want to miss brushing your teeth one day. You shouldn't want to miss your mobility training. Even if it's just 10 minutes every day, think of it like the brushing and flossing, keeping your joints mobile and healthy. And that's also going a long way in helping you enjoy running. And then sleep, nutrition, stress management, all these things also interconnect, right? Because if you're overweight or just sleep deprived, or you're just eating junk food, maybe you're eating average weight, but just eating a bunch of junk food, your joints are inflamed, that can also set you back as well, right? So there's a common belief that, I could just stretch 30 seconds and that's going to be enough. No, just stretching alone is not enough, especially just short stretching. A lot of runners I'm just going to do a quick 30-second stretch before my run. No, I'm talking about a solid mobility routine. And mobility is different than stretching, right? Stretching is usually just passive stretching for some muscle group or whatever. And I'm talking taking the joints through proper ranges of motion, typically full ranges of motion or whatever motions that your body allows, but what have you. You want to take, the hip, the knee, the ankle, all these joints have their proper ranges of motion. So it's actually mobility training is also taking the joint through its range of motion, but it's also going to make you more mobile, agile, and what I call that more athletic runner. And then this idea that, because if you're in pain, you have to stop running altogether. It's often just a single to adjust training. Sure, if you're in severe pain, you're limping, you can't even move your leg, yeah, you do have to take a break from running. But if it's more mild pain or even some moderate types of pain, you could oftentimes work around the injury, modify the running workouts, doing rehab exercises to help you get rid of the pain. Arthritis doesn't mean a death sentence, right? Doesn't mean you have to quit running altogether. Oftentimes it just means, again, you could just have to do the proper strength mobility training. And this is what I did with my client here who was in her 50s, who was told, you have like bone, you have this really severe arthritis. It's almost bone on bone. You may have to get knee surgery. You may have to get it sooner rather than later. No, we were able to work together. And she even tried past PTs in the past. She just didn't understand how to work with runners. And, with my specialized training and working with runners, I was able to help her get pain-free, improve the strength mobility around her knee, but also the muscles above in the kinetic chain, including her hip, her ankle, because they all played a part in how her knee felt, and improved her form, her biomechanics, and she was able to enjoy running pain-free, right? And so, sometimes some doctors will say that running is bad for your knees. If you do running improperly, sure, you could blow up if you do too much, too soon, too fast. But if you do smart running, if you tailor it to your ability level, your recovery level, right? If you're not just, hammering high mileage or having a smart recovery plan, it is possible to enjoy running without destroying your knees. And in fact, a lot of studies have shown that many runners have lower rates in arthritis than non-runners, right? It just, again, involves smart training and, being smart about your recovery, the mobility, the strength, the maintenance work, so you can enjoy running. So why do many running injuries happen, you may be asking, right? So you typically load because the demands of running, there's a mismatch between your body's, your tissue capacity, your body's capacity to handle the demands or the loads of running, right? Whether you push the speed, the mileage, or you do different types of hill workouts, etc., or other types of activities, maybe that load compounds over time. And this is why even on a 6 days per week running, even though you may have some recovery runs in that week, if your body can't recover from that, even though you think you're doing a recovery run, that might still a stress on your body. And if your body's not able to recover from that stress, it just adds up over time. And then your body breaks down because your body's not able to handle that stress, that load you're placing on it. Maybe you're not getting enough sleep. You're not getting enough rest. Maybe you're too stressed, not fueling properly. Maybe you're underfueled, or just eating the wrong food. You're eating too much junk food, or your just tissue's not strong enough. You're not doing the proper strength and mobility training, right? Then that's going to lower your capacity to handle the demands of running. And this is how oftentimes we help people overcome this by building up their body's capacity. And that's why I'm a big fan of what I call the athletic runner method, to build up that tissue capacity. So what happens when you train this way, right? You're able to enjoy running pain-free without recurring injuries, improve your speed and endurance with less mileage, build a stronger, more resilient body, continue running in 40s, 50s, 60s, and beyond, and enjoy running again instead of fearing breakdown. And this is how I helped my client, a woman in her 50s, avoid knee surgery and go on to run like the New York City Marathon pain-free, despite having knee pain for years. So if you want a personalized roadmap to running pain-free, book a free strategy call. We could talk about, what's holding you back, what may be some of the root causes of this pain, or even how to prevent the injury if you're not currently in pain. So I have 2 spots available this month. First come, first serve, so take action now. So the big takeaway, right? You don't need to run more. You just need to train smarter. Longevity comes from strength, mobility, and proper structure, not just running alone. Anyone can become an athletic runner with the right system.